Hey, it's Frank. Welcome back to the program. It's Wednesday, August 9th. A friend of mine, a huge fan of Trader Joe's, has been encouraging me for some time to get in there. The Trader Joe's near me is not a very welcoming place. The parking is horrible. For that reason only, I've thought not to go there because the parking is so bad. Getting in and out of the place is just terrible. And it's beside another strip mall that has even worse parking. So just the ins and outs. But I found a little morning trip on a Sunday or a Saturday when it first opens, get over to Trader Joe's, and I've finally gone. I'm a fan of Indian food. There's not a lot of great Indian food in Stanford. And I'm always a little suspect of Indian restaurants for lunch. So I've been looking for other sources, and she turned me on to these pre-packaged meals. I think I may have mentioned this in a prior podcast. Frozen dinners, frozen dinners at Trader Joe's. The chicken tikka masala and the butter chicken, the Trader Joe's brand. And they have these frozen naan bread. You stick in the oven for 2 or 3 minutes at 400 degrees. They come up really nice. I can't have enough of these things. Just phenomenal. Are we fans of Indian food? Anyway, great meals, Trader Joe's. In my life, never had a frozen dinner. Anyway, I had another one last night. It was so good. Naan was so good. All right, what's on the brain today? Couple things today. Household debt and Obamacare, aka the Affordable Care Act. So I'm going to check in, go see the New York Federal Reserve, which regularly tracks household debt. Household debt, second quarter 2023, reached $17.06 trillion. Ooh, a new record. So you had household debt at 17 trillion. Let's do a little math. I'll get my calculator out. 17 trillion from household debt, 33 trillion in federal government debt. We have another about 6 trillion in state debt. And we have about 16 trillion in corporate debt. That adds up, ladies and gentlemen, to $72 trillion. Ouch. Not good. Anyway, the New York Fed produces the microeconomic data, quarterly report on household debt. Showed an uptick in household debt in the second quarter of 2023, increasing by 16 billion. Now, the scary part of this, and of course, this relates to the economic discussions we've been having for some time now, that is the recessionary pressures building the economy. Credit card balances in the second quarter increased by 45 billion, from 986 billion to 1.03 trillion. That's a new record, 4.6% increase. Credit card accounts expanded by 5.48 million to 578.35 million. And aggregate limits on credit cards increased by 9 billion and now stand at 4.6 trillion. So kind of a scary scene there. Of course, this is what consumers do, households do when they have cash flow problems. We can think primarily about inflationary pressures been experienced for the past couple of years as one of the main culprits. Challenging job outlooks. Now, we've talked about jobs before, and we're creating jobs, but the quality of the jobs and the pay of those jobs is not very good. And households are struggling. We can make the very obvious distinction between lower income households, middle income households, and wealthy households. And of course, when we think about this, we're thinking lower middle income to the poor that are really battling the most. Mortgage balances were largely unchanged at $12 trillion. Auto loan balances rose by 20 billion. Student loan balances fell by 35 billion. That takes us to 1.57 trillion in outstanding student debt. Delinquency rates were roughly flat in the second quarter and remain low, which is good news for sure. Although we are seeing increasing delinquency rates for credit cards, auto loans, and personal loans. Clearly, credit card balances saw the most pronounced worsening in performance. Student loan performance is unchanged, as I indicated, but the real risk is the credit card balances. Delinquency rates have edged up. Again, we're normalizing, nothing too severe on the delinquency rates, but they're rising. You can see on the charts here on the screen, mortgage debt fell 12 trillion. Home equity lines of credits rose to 34 billion. Student debt fell by 35 billion to 1.57 trillion. Auto debt rose by 20 billion to reach 1.58 trillion. Credit card debt was up 45 billion to 1.03 trillion, a new record. Then we have other outstanding debt. And you can see the delinquency rates as well. And what's, of course, should grab your eye right away is the change in credit card and other debt. I even include auto loan debt there. Big jumps from 1.81% to 2.4%. Credit card debt, 3.35% to 5.08%. And the other personal loans, things like that, 3.21% to 4.65%. This report is another sign that households are struggling in the face of rising costs, flat real incomes, and job challenges. Of course, credit card debt, the big challenge there is the interest payments. When we look at Fred, commercial bank interest rate on credit card plans, all accounts, we can see the big jump in interest payments. Now at 20.68% for credit card interest payments. And of course, that is the real burden for increased credit card usage. Those minimum monthly payments can rise quite sharply. And of course, minimum monthly payments is not enough to manage your credit card debt. Anyway, something to be concerned about and watch when we think about recessionary pressures building the economy. All right, the other topic I want to talk about today is Obamacare, aka the Affordable Care Act. Passed in 2010, full implementation occurred really 2013-ish. President Barack Obama's signature legislation. When he ran for office in 2008, healthcare was a major issue. Many on the left wanted the single-payer national health insurance, but President Obama pledged private health insurance reform instead. He made repeatedly the same promises over and over again. He was going to reduce costs, increase access, and improve quality. By the way, we knew right away that those three things could not occur simultaneously. You can get two of those things, but not all three. Promised to insure the uninsured with private coverage. Promised to bring down healthcare costs with savings of $2,500 a year for every American family. Give people with inadequate insurance better insurance, but let people who like their coverage keep their doctor and keep their plan. That turned out to be one of the biggest lies of this plan. And discrimination against people with pre-existing conditions. We have estimates of around 25 to 28 million Americans without health insurance. While he promised private insurance was going to be the method by which he got people insured, almost all the increase in health insurance coverage under Obamacare is actually increased enrollment in Medicaid, the government insurance program for the less well-off, for the poor. It was really the Medicaid Expansion Act. Much of that enrollment was intentional, but there was also a lot of fraud in this Medicaid Expansion Act due to lax governance, and billions of dollars of improper payments have been doled out. And because Medicaid pays the lowest rates to providers, doctors, many doctors won't see Medicaid patients. Those who do tend to push Medicaid patients to the rear of the waiting lines. So really hard to find a doctor in your area that even takes the plan. After 2013, premiums in the individual market more than doubled and deductibles skyrocketed. Combining the average premium with the average deductible, last year a family of four not receiving a subsidy had to pay $25,000 out of pocket before receiving any benefits from their health plan. That's quite shocking and a huge change from prior to Obamacare. There are low-wage workers employed by fast food chains and other establishments. Under the law, employers are required to offer health insurance coverage and charge their employees no more than 9.6% of the employee's annual salary. However, these plans can have a deductible as high as $8,700, and the employee must pay the full premium to cover any dependents. Most employees in this situation turn down these offers. And once the offer was declined, neither the worker nor the worker's dependents are entitled to any subsidy in the Obamacare exchange. And so today, everyone who comes to the individual market faces sky-high premiums and deductibles and narrow networks that typically exclude the best doctors and hospitals. Any of us that are using healthcare know this is the case. I recently have been battling a knee challenge. I had to pay quite a bit of money out of pocket before I got any benefit from my insurance coverage. The Commonwealth Fund did a 2022 study of the Affordable Care Act. Their conclusions are not good. They say because the law was built on the existing private insurance system, people can still experience coverage gaps. They say the study reveals many people experience chronic structural uninsurance. These include people who fall into the Medicaid coverage gap in the 12 states that have yet to expand Medicaid, as well as undocumented immigrants who are not eligible for federally subsidized coverage. Their study reveals 43% of working age adults were inadequately insured in 2022. These individuals were uninsured 9% of the time, had a gap in coverage over the past year at 11%, or were insured all year but were underinsured, meaning their coverage didn't provide them with affordable access to healthcare at 23%. 29% of the people with employer coverage and 44% of those with coverage purchased through the individual marketplaces were underinsured. 46% of respondents said they had skipped or delayed care because of the costs, and 42% say they had problems paying medical bills or were paying off medical debt. That first part there is really intriguing. That because of the costs, the high deductibles, people literally don't use their health care, even though they're paying a monthly premium to have that health care. Really, really sad. Think of a family of four having to confront that. 49% of those surveyed said they would be unable to pay for an unexpected $1,000 medical bill within 30 days, including 68% of adults with low income, 69% of Black adults, and 63% of Hispanic adults. 68% of Democrats, 55% of independents, and 46% of Republicans said President Biden and Congress should make healthcare costs a top priority in the coming year. Well, the bottom line is Obamacare was supposed to solve this problem. Obamacare was going to reduce costs, increase access, and improve quality. And it's failed in all three areas. Since 2010, every election cycle, so every 2 years, Republicans across the country have vowed to repeal Obamacare. And every election cycle, they fail to even try. They all go on the campaign trail, lie to their constituents. We're going to reform or eliminate Obamacare, the Affordable Care Act, and they don't do anything about it. It's now 10 years of a full implemented program, and there's lots of people benefiting from this program. Think of what's happening to the privatization of our medical care. It's one of the challenges we have with this insurance issue is the privatization of our medical care. Think of what happened to CVS and Walgreens and Rite Aid getting involved in the medical world, convenience stores, getting involved in the medical world, the healthcare world, because of the incentives for profitability induced by the Affordable Care Act. We have for-profit hospitals dominating the medical care community right now. That is very dangerous, very bad for health outcomes, for access to medical coverage. So still work to do on the health insurance market here in the United States. And a big part of that work is going to be reforming or eliminating the Affordable Care Act. 30-odd million uninsured in 2009, 27 million uninsured in 2023. Higher costs, reduced access, and lower quality. A C maybe? Can we give it a C? I think that's the highest grade we might consider. A quick check on markets and data. Remember, I've been telling you to sell rallies and equities. Well, a good opportunity was missed if you didn't sell rallies on Monday. Because yesterday, Moody's, the rating service, downgraded 10 mid-sized banks in the U.S. And that spooked markets very sharply. All three major Wall Street benchmarks finished lower on Tuesday. A broad sell-off after several lenders were downgraded by Moody's, and 6 other banks, bigger banks, were put on ratings watch for potential downgrades, including Bank of New York Mellon, U.S. Bancorp, State Street, and Truist Financial. Spooked markets yesterday for sure. Little sell-off. Also, we had the U.S. trade balances, goods and services for June out yesterday, $65.5 billion deficit, worse than expected. Thank you, China. And then this morning, of course, Wednesday, every Wednesday at 7 a.m., we had MBA mortgage applications for the week ending August 4th, down 3.1%, a little worse than expected, compared to minus 3% in the prior week. 30-year mortgage back above 7% at 7.09. All right, that's all I have for you. Always try to buy American.